Do you know the number one complaint I hear from our healthcare workers is something they've come to call the bureaucratic vortex? That's what happens when a critical decision, hiring a nurse, ordering basic supplies, fixing a broken process, gets tangled into the web of bureaucracy and approvals. And instead of timely approval, it just spins for days, sometimes weeks. A vortex of approvals, of delays. And while it spins, our facilities stall, patients wait, and frontline staff struggle to care for patients with their hands tied behind their backs. So we are going to make some changes that will allow our hospitals to keep things moving forward. Before I tell you how, let me show you what that vortex looks like in real life. A department head tries to fill a maternity leave. She sends the request up the chain, but the approval doesn't come back until the nurse is almost back from her maternity leave. And sometimes it's as basic as buying chairs, but the hospital has to wait weeks for central purchasing. This is what the current structure has created: distance from the problem and delays in the solution. It's costing us time. It's costing patients time. And it's costing Albertans the care they deserve. That's why we're making a change. We're moving away from a heavy corporate administrative structure with more local decision-making through hospital-based leadership. Soon, each facility will have an empowered leadership team supporting our sites, responsible for hiring, managing resources, and solving problems, without sending every request into the vortex. Sites will have the ability to direct dollars to the greatest need and action local decision-making. Because when the people closest to the problem have the power to fix it, things get better. Albertans are entrepreneurial by nature, and they expect their public services to run with the same urgency and common sense. In business, you can't afford delay. A grocer doesn't wait months for head office approval to cover a staff member on leave. They hire someone and keep the shelves stocked. A contractor doesn't sit on a broken tool waiting for permission. They replace it and keep building. That's how things work when you trust the people on the ground. And it's time we trusted our hospitals to work that way too. The truth is, every facility in Alberta is different. What works in downtown Calgary may not work in Peace River. The needs of a rural emergency department aren't the same as a trauma unit in Red Deer. Hospital-based leadership gives each facility the flexibility to respond, the freedom to adapt, and the authority to act. Because one size fits all doesn't work in healthcare, and it never will. Let me be clear. Alberta Health Services will still play a vital role as a provider of hospital-based services. They will have a renewed focus on priorities, including improving wait times and supporting high-quality hospital care for patients across Alberta. They'll continue to set boundaries, track performance, and hold leadership accountable. But from now on, local leaders will have more authority to make the right call and more accountability to deliver results. We're not the first to make this move. Countries like the Netherlands, Norway, and parts of Australia have already made the shift to hospital-based leadership. And they've seen faster service, better patient outcomes, and stronger staff retention, all while staying accountable. When you trust the front lines, results follow. Here's why this shift matters for you and your family. Empowered leaders and teams, faster decisions made on-site, not in a faraway office. Smarter staffing. We hire when we need to in order to meet the patient needs, not when bureaucracy allows it. Better morale. Empowered staff stay longer and can work more efficiently. Flexible facilities. Solutions tailored to each hospital's unique needs. It's about putting patients first, not paperwork. The bureaucratic vortex ends here, because every hour saved on bureaucracy is an hour gained for patient care. And this is just one more step forward. We recently launched Alberta's patient-focused funding model, which ties funding to the results delivered to you. It's a smarter way to support you and support the facilities doing the work. We've linked that video below so that you can learn more about that initiative too. Because in Alberta, we don't settle for slow systems. We fix what's broken. We back our frontline workers, and we build a healthcare system that delivers for patients. Please share this video.